Good morning. My name is Richard Wexler. I'm Executive Director of the National Coalition for Child Protection Reform, and I chair the Subcommittee on City and State Procedures of the Philadelphia City Council Special Committee on Child Separations. This meeting is being recorded. I will send out the recording to the committee and post it online. Since I don't yet know what the URL will be, I invite anyone else who wants to see the recording to please email me at rwexler@nccpr.info. I hope to be joined a little bit later by the other members of the subcommittee, Robin Cooper, President of the Commonwealth Association of Supervisors and Administrators, and Attorney Nadim Bizar. We also may be joined by members of the full committee who are welcome to join in our discussion this morning. Anyone else is welcome to post comments in the chat. Now, I'm not great at multitasking, so I may not always see them, although I do see an excellent one introducing the role of one of our guest speakers. But as I say, I will certainly review them after the meeting. This is one of a series of meetings examining different city and state procedures. Next week at this time, we're going to examine the state central registry of those alleged to have committed child abuse. I'll send the meeting notice for that one a couple of days ahead. Again, please email me if you want to receive these notices and are not getting them now. This week, the topic is child welfare and substance use. And what I'm going to do now is put several links into the chat provided to us by one of our guests. And I hope that worked. Yeah, looks like it's there. Okay. They may have been cut. It looks like they were cut and pasted in a way that don't include the actual links. So I will come back and resend when I send out the video to the links that were provided. I do want to highlight, when I do send them back to you, the one from the Movement for Family Power. It is both a fine introduction to these issues and an outstanding in-depth discussion of what goes wrong and how to fix it. It uses the New York City system as a model, but it applies equally to any city. So we will begin now with an overview from Nila Natarajan, Supervising Attorney and Policy Counsel for the Family Defense Practice at Brooklyn Defenders Services. Well, that's one of the institutional providers of family defense in New York City. They provide high-quality interdisciplinary family defense, the model used in Philadelphia by Community Legal Services. Ms. Natarajan is cited often in the imprint story about child welfare and marijuana that I have included in the chat. And then we're going to hear about how these issues play out in Philadelphia from two local experts. Ariel Narba is Doula Support Program Manager in the Division of Maternal, Child, and Family Health at the Philadelphia Department of Public Health. Rachel Santiago is a fellow at the Dignity Act Now Collective and a trauma-informed family reunification intervention specialist, as well as an impacted parent herself. We are now joined by the way, one of the other subcommittee members. Mr. Bizar is with us now. And with that, I'm going to turn this over to Ms. Natarajan. Please go ahead.
Good morning. Thank you so much for having me here today. I'll start by taking a little bit of a step back when we talk about the children protective services and child welfare system and substance use. First, I'll say that the terminology that myself and a lot of advocates prefer to use for the child welfare system is the family regulation system or the family policing system. And I would actually reference Philadelphia's own Dr. Dorothy Roberts with really putting that type of language on the map. And the reason I start there is because in my office for more than the last 15 years, we represented thousands and thousands of parents in Brooklyn accused of abuse and neglect in Brooklyn Family Court. And what we've borne witness to is the tremendous harm and violence that the family regulation system imposes on parents and children and families through an investigative, quote unquote, process that is largely composed of surveillance and punishment rather than support. And the reason I want to start there is the context for, I think, the way the family regulation system operates in the context of parents using substances is based in surveillance and punishment that's rooted in many ways to the war on drugs. And so as a family defense advocate who works closely with our criminal attorneys, we know the ways in which the criminal legal system is, rooted in racist underpinnings. And we know for the last 3 decades, the quote unquote war on drugs has disproportionately harmed and punished Black and brown communities, poor communities, immigrant communities, the same communities that are disproportionately impacted by the harms of the family regulation system. And I think a lot of us, because of the misinformation promulgated via the war on drugs, have not been given real robust, meaningful and education around what substance use really is, what substance misuse or chaotic use might look like. And I think all of the ways in the family regulation system treats families and parents around substance use is rooted in that same type of misinformation. So I don't want to take up too much time, but I kind of have 3 takeaways. And one is that in New York State, a large, robust coalition of parents and advocates and attorneys have come together, and both in our state assembly and Senate, we've proposed an informed consent piece of legislation. And what it would, under that legislation, it would require medical providers to get the informed oral and written consent of pregnant people, birthing people, to be drug tested by their medical providers, and also for their newborns. And yes, in that legislation, there is an exception for a medical emergency. And what we're really saying is that a medical provider shouldn't be drug testing their patient absent a clear medical purpose. And the reason why I did my whole spiel in the beginning is if there is no clear medical purpose, then the drug test is just a tool of surveillance and punishment. And that's why I want to start with that informed consent legislation, because it gives the people really impacted by that surveillance and punishment the knowledge and information, and empowers them to make the right decisions for themselves and their children. And that takes me to my second key point, which is that a drug test is not a parenting test. If someone, whether it's at the birth of their child or when their child is 10 or 15, takes a drug test, hopefully with their consent, with a full understanding of what that means, and they were to quote unquote test positive for a substance, it literally says nothing about their ability to safely parent their children. And in our work, we see that time and time again. It says nothing about, first of all, it says nothing about their substance use, right? It says nothing about the frequency that they may use a substance, when, how, and how it impacts them as an individual. And it certainly doesn't speak to other resources and support they may have in their efforts to responsibly and safely parent their children. And to that end, I have to say, as someone who has represented so many parents who have been completely dehumanized and demonized because of their substance use, that not all substance use is kind of chaotic or unmanaged or irresponsible or unsafe. I think as adults here today, we know many of us and many people, for example, safely consume alcohol or safely consume marijuana, and are still able to responsibly and safely parent their children. And again, the reason I started with that war on drugs is we have a lot of misinformation about the impact of other substances on an adult. And we have a lot of misinformation about how an adult can use a substance in a way that isn't necessarily harmful to themselves or really to their ability to safely parent, which is supposed to be the limited purview of the family regulation system. And then my last key point, I know I've been going on for a bit, is that CAPTA CARA, the federal legislation that I think a lot of states have interpreted to require the state to call in DHS and call an investigation, is very clear in that law that it does not require such a call. It does not require an investigation. It doesn't define abuse or neglect in any way. It does require a plan of safe care. And the reality is that an investigation and a family separation is not care, is not support, is not treatment. So if we really want to support parents who might actually be struggling with substance use, which I have to name again, is not, in my experience in New York City, is not the vast majority of people I work with. But if someone is really struggling, real support is humane, quality treatment, medical care, mental health support, housing, income. That's what families need. And I think the last thing I'll say, this is true at the birth of a child, and I think through the social science shows throughout the course of a child's life, that family separation is incredibly traumatic. And conversely, even to a newborn, and that I can provide more medical information if that's something people want. But the converse is also true, that keeping a child with their parent or caretaker is incredibly beneficial to them. So if we can support a parent with those real services and supports rather than surveillance and punishment, we're actually supporting children as well.
Great, thank you very much. Ms. Narva or Ms. Santiago, whoever wants to go first, can now tell us what the situation is now in Philadelphia.
Hello, good morning, everyone. I'm Rachel Santiago. I go by she, her pronoun, and I am with Dignity Act Now Collective. I am the Family Intervention Preventative Support Specialist, and I got into it. I am an impact leadership, yes. I have done some time. I was charged with child endangerment. I have come home to cook Thanksgiving dinner, and I was charged with child endangerment when my 4-year-old great nephew had disarmed a weapon and shot my 2-year-old son. But prior to that, I had just came home after my 11-year-old has sat in nearly 2 years in the hospital fighting leukemia cancer. And even though I was not responsible, I was the adult in the house, and I had literally just came into the house. So, and I was only there for like an hour, and I was so busy running around getting dinner done. I had just breastfed my year-old child, the baby, the youngest one, and my son was 2 years old at the time. So the 4-year-old disarmed the weapon, shot my son, and my spouse was upstairs sleeping, and the one that was responsible for the children while he worked and I lived in the hospital was my half sister, who had issues with substance abuse. And because there was no relationship with any other family members, I opened up my home. And then, of course, you know, the parents was the one who had to serve the time. I did 14 months incarcerated. And prior to that, I'm gonna give you a little background about me. I was a coordinator for psych and drug and alcohol, and I was an assistant administrator with Genesis Healthcare and Stage. And I was already 3 years in my master's degree and starting with my PhD upon graduating to practice general physician care, run a hospital. So because of the felony, I can no longer practice medicine. So upon release, I started advocating into my community and providing services. And then I met 5 wonderful women from, you name it, from juvenile lifers and everything. And all of us got together and said, you know what, even vets who have returned home from serving years of prison sentencing decided, let's open up this nonprofit organization under Mary's Daughter for the Formerly Incarcerated. We started crafting and creating policy for change that rotates around women incarcerated, especially for mass incarceration, programs that literally worked and helped these women, especially the non-shackling law for women giving birth in prison systems. And of course, I was like, you know what, I came home and I fought really hard to get my children home. And there's this thing that said the first impression is the last impression, but you know what, the first impression you received of me wasn't the impression you were supposed to receive of me. Because I did not do drug use or anything, but I was rejected of medical attention while I was incarcerated because of the everyone that was going in, you know, they needed some sort of support in there, whether it was medication or so if you asked for something for pain, they automatically thought that you needed something to fix you. And even if you sign your medical release form that, listen, I'm under the care of a physician, I need medical attention and everything. And what everybody, what I didn't share with each and every one of you, I am currently on chemo. and I'm going blind and deaf due to medical negligence while I was incarcerated because the medical system failed to assist me while I was ill in there. And then when up on my release, I spent the last 5 months with my daughter before I laid her to rest. May 14th that just passed was 3 years that my daughter was passed away. So after she passed away from the leukemia, I fought hard. So May she passed away in 2018. I was released January 2018. I continued my advocacy work, working with ACLU, Community Legal Services, and the Incarcerated Women's Working Group and Dignity Act Now Collective. We launched 2019 in February. 6 Women Impact Leadership. We have the HB 1004, the Ombudsman, the Trauma Informed Bill that I teach trauma informed and healing. And we have, reproductive justice bill.
Thank you.
And we
I'm
also
sorry, please go ahead.
collaborate. I apologize for that. We also collaborating with Legislator Summer Lee on the trauma and healing bill, as well as we're collaborating with again for the alternative sentencing, as well as the Affordable Care Act to reduce incarceration in our jail systems to provide these women home. I am working on numerous cases with women that are fighting for their children reunification, and it's very hard. Women who are in treatment for dual diagnosis. The thing is that many women have suffered from traumatic events, and they go looking for coping mechanism. And the thing is that once they become pregnant, that they had already went through all the substance that they could do. And when they're pregnant, they're already receiving treatment. During treatment, they are still continuing with their treatment. They're going to their meetings. They're on Subcommittee, methadone and everything. But when they go to give birth, there are negative effects with other medications. And that is not being followed up. That's something that needs to be considered. And as you know, when the epidural come up, they're tested for fentanyl. The children are tested for it. And that's not being considered a consideration. Like the judge is saying, okay, take the children away, but they are in treatment. They're following. I understand if they're not under a doctor's care, they're self-treating, but they're in treatment. And the thing is, once you become pregnant, you're constantly getting urine, blood tests. Your history is going through with the physicians. All doctors should be on board with your care. Whether it's mental health, your OBGYN, your primary care doctor, and any specialist that you see, they should all be on board from the beginning to the end of your pregnancy to avoid any miscommunications. And something that needs to be uplifted is that your history is always determined in the beginning. And the doctors should always keep that in mind. They're always, your history follows you. They must take that into consideration. And we are all state mandatory reporters, but you must always take an accountability the history and that they are in treatment. But there are times that people don't follow up with the history, and we all human beings, we make mistakes, but we must also take accountability for the mistakes that we make. We must understand that we're all human beings. Substance abuse does not determine our parental skills. It does not, because you have addicts that are functional addicts. They go to work, they make their money, they pay their bills and do what they gotta do. They provide for their children and everything.
Okay, I'm sorry, I do apologize. Sometimes when you pause, I think if you still have more to say, please go right ahead.
No, that's quite all right, and I'll pass that along.
Okay, before we do that, just one request. Can you please email me links and summaries of the legislation you mentioned? Because that's something we will be.
I will be
very
glad to send you the links and
I will.
The bank is involved.
And I will circulate to the full committee. Now, Ms. Narva.
Hi, everyone. Thank you for having me. It's good to see you all. Thank you, Nilla and Rachel, for that context. I am here on behalf of the Department of Public Health in the Division of Maternal Child Family Health. I manage our doula support program, which is a direct service program. And for those who are maybe not familiar with what a doula is, it is a trained non-medical, so non-clinical professional who is trained in all aspects of the perinatal health period. So people who are trained to offer continuous emotional, educational, informational support to pregnant and parenting people. And our program receives Title V funding from the state, so maternal health funding from the state of Pennsylvania Department of Health, to specifically focus on offering doula support to pregnant people, parents, and families with a history of or current substance use disorder, including but not limited to opioid use disorder. And we were also tasked by the state to offer that support for up to 1 year postpartum, which is in direct response to rates of relapse and overdose, both fatal and non-fatal, in the first year postpartum. So what I can say, from our perspective as a direct service program, is that in order to, really make changes to this system, we have to invest in the leadership of impacted parents in these conversations. We cannot reform a system and make positive and important and urgent necessary changes to, systems of family regulation, child separation, and so forth without people at the table who have themselves experienced that system. I think that we probably all know that as far as DHS in Philadelphia, there is a difference between policy and practice. And I think, a lot of what Nilla and Rachel said, I just, want to echo. I think as far as the parents that we support, the majority of them are, the vast majority of them are already in treatment for substance use. So we are referred to them, whether they're pregnant, early on in their pregnancy or later on in their pregnancy, or even postpartum. A lot of times we're referred to them in the context of their treatment program. But that doesn't mean that, they have the support necessarily that is needed from the systems that they're involved in. I definitely want to lift up something that Rachel said, which is we have seen parents who are in treatment for opioid use disorders who receive pharmacotherapy, whether that's methadone or Suboxone, test positive for fentanyl after giving birth because they received an epidural for their delivery. There is a lack of information and education among providers, and it is really important that we do a better job training our medical providers. I can't tell you how many meetings the doulas, the program staff, and I are in meetings or trainings, and the ultimate takeaway is we need to have compassionate care for these families. Well, we're doulas. We know how to offer compassionate care. That is, it is something that we're called to do and trained to do, walking with a pregnant person through this very vulnerable and intimate, life moment is something that creates a unique relationship that I think really highlights all of the inequities of the systems that these parents are encountering because we offer that compassion, because we have that emotional connection that, you were there when they pushed their baby out, or have been, planning for the arrival of a new baby, or are navigating multiple systems at the same time, whether it's a treatment system, substance use treatment system, family regulation system, criminal and justice system, medical system, housing, everything. And the last thing I'll say is that I definitely want to just center trauma as well in this conversation. I think, fortunately, it is becoming more popular to discuss trauma in general. And I know everyone, including the state, when they created the work statement for this program, mentioned trauma-informed care. And I think when it comes to working with people who are either in recovery or using drugs chaotically and everything in between, we need to really look at that substance use as a coping mechanism for trauma that they have experienced. And the systems that they then are, involved with need to also, focus on that trauma and center it, and also highlight the trauma of child separation on the entire family system. That is something that has multi-generational impact, and it has to be a part of the conversation. So I guess I'll just leave it there for now.
Great, thank you very much. I'm very glad that you left it on that point about trauma, because it never ceases to amaze me that so many people who discuss adverse childhood experiences and trauma neglect to mention the removal of children from their homes, which is among the very worst traumas you can inflict on a child. And you cannot fight trauma with trauma. Before I ask any questions, Nadim Bazar, is there anything you'd like to ask?
Yeah, thanks everyone this morning for participating. I will tell you, I am a little bit behind the times, so to speak. And what I mean by that is that the work I do does involve children that are harmed once separated from their family dynamic. I've been doing that work in the city of Philadelphia and around the city of Philadelphia and throughout the country for the better part of 10 years. And one of the measures, and Nilla, and it kind of goes down the line here, is not fully understanding that child separation itself is something that's traumatic for a child, right? So what we always look at is a child's been placed in foster care and a child is harmed while in foster care, and those are sort of the obvious tort lawsuits that have been filed. But no, I'm intrigued, and I actually wrote down that family separation is incredibly traumatic. So that to me seems, I think we would all raise our hands that we're in agreement with that statement. But you took it sort of younger along the continuum. You said even at infancy, right? And I think that's important, because when we hear the potential for a bad outcome or someone being harmed, our knee-jerk reaction is to separate, right? And Richard, last week we had people in the school district and they talked about fights in the hallway, and we had this vision of a teacher getting in between two fighting students and separating them physically. And now we're doing the same thing with babies in our dependency court system. So Nil, I would be interested in if you could share some of the literature that you had talked about. That would be very exciting for me to take a look at. And then I appreciate being sort of enlightened to this issue about separation with infants, right? So again, as a 4-year-old, a 5-year-old, a 6-year-old, I can see that and going up, of course, but an infant never struck me how bad it would be. And given the nature and the reason for the development of this committee, I think that becomes very powerful. Thank you.
Can I add something to that? Is that all right,
Please,
Richard?
please.
Well, definitely, given that this particular doula program was created in the context of the opioid crisis in our city of Philadelphia, we do work mostly at this moment with parents with a diagnosed opioid use disorder who are in treatment, which means that when the infant is born, they are monitored. It is city policy for 5 days postpartum to see if they will require treatment for withdrawal and admittance to the NICU. And for those infants, whether they are admitted for the syndrome, which is known as neonatal abstinence syndrome or not, those infants, the way that the system is set up, they don't have their parents. Mostly, unless something happens, which fortunately we haven't seen, 100% of these mothers are discharged without their infants. So that is in itself a trauma. Can you imagine having a baby and you go home without it? And then if your baby is admitted to the NICU, all of the research, which I can also share with you, Nadim, and with this committee on the treatment of neonatal abstinence among infants, is that all of the research shows the best practice is to keep the mother-infant dyad together at all costs. So testing a mother, testing a baby for substances, and then removing that newborn, 2 hours, you know, whether it's 2 hours or 2 days or 2 weeks postpartum from their mother, is not only traumatic on a social emotional level, it is actually harmful to them on a physiological, biological level. It is in contradiction to what is in the best interest of their medical health. And so given that we do have such an urgent opioid crisis in this city, and we are seeing more and more babies born with neonatal abstinence syndrome, which is certainly part of why this program was funded by the state, it is really important to look at, you know, how are we treating these babies and how can we keep them with their mothers so that they are actually able to live healthy lives.
It appears the knee-jerk reaction is to do opposite of what would be the most effective, right? So like if the knee-jerk reaction is separate, and we should be doing the opposite. I think, and I don't want to change topics too much, but I think that probably an understanding of how this situation should be handled, because we can see there would be confounding variables, right? Like there is this issue of, is this somebody who is improving and is best suited to take care of this child that's born with this syndrome, or is this somebody who is struggling and needs help from the system? And that's that sort of fine line that we maybe need to invest in. Thank you.
Let me just add one thing which I will share with the committee. I will send a link to information about it, which touches on what we've been talking about now. And that is a study that goes all the way back to when the issue was crack cocaine. And it was a study of infants born with cocaine in their systems. One group placed in foster care at birth, the other group left with their mothers. And these infants were measured, their actual physical development at 6 months, sitting up, reaching out, rolling over. Consistently, the children left in their own homes did better. I want to move to the topic of so-called plans of safe care. Now, the theory behind that is it's not a child abuse report. We're going to call the same agency that handles child abuse reports. We're going to report that there are drugs in the infant system, but it's not a child abuse report. It's just a way to get help for this family. How does that play out in real life? And Nila, you're already, I think you started to give the answer, so please go ahead.
And speaking to Ariel and Rachel, I think in Philadelphia hospitals, procedurally things work a little bit differently than in New York City, but I think substantively the same thing happens. And look, we've talked to doctors who I think genuinely think this person needs help or this baby needs help, so we're going to call our equivalent of DHS because they're social workers and they help. And there's a real misunderstanding that it is essentially calling the cops on someone. It's that level of seriousness, severity, and harm. It is not treatment, it's not access to treatment, it's not access to housing, it's not access to childcare, none of those things. And so to me, the add-on to what we've been talking about, the harm of removal, is the harm of the investigation itself undermines a parent-child relationship. It's incredibly traumatic. It is like a cop coming to your bedside after you've given birth, asking you incredibly invasive questions when you've just undergone like a serious medical, event, potentially surgery, asking you to sign paperwork to release your confidential information for you and your child, your medical information, your mental health information, with no understanding, with no information about the consequence. So that's my little spiel on that. But in terms of our misunderstanding of the law, Capta Care simply just doesn't require an investigation to be called in, and calling DHS is what it is. If there needs to be another legal mechanism, if we need reporting under Capta, if we want that funding, there needs to be another legal mechanism by which this diagnosis can be documented. The real goal of Capta Care was to get documentation of the amount of services that are needed for parents and children in this situation, to ensure that there's enough funding for those services. It's not intended to be an intervention on the family level. And it's certainly not intended to create an investigation, essentially a criminal proceeding.
The one thing I would add to that, in terms of CAPTA, as you said, you need to have some kind of reporting to get the money. At least in Pennsylvania, the money is really small. We're talking maybe $2 million for the entire state. You would say it costs more to conduct all the needless investigations and needless foster care. So if Pennsylvania wanted to do the right thing and use a treatment response instead of a policing response, and leave it to the professional judgment of the professionals when a policing response in those very rare cases is necessary, it could be done with little actual financial penalty. Anybody else want to jump in on CAPTA, Plan of Safe Care, Ms. Narva, Ms. Santiago, or other points that we've raised so far in the discussion? Okay, then I will move on to one other question. And it's a question that I saw in the chat on another webinar that I was on. And we were all, I think, have lost track of what webinars or which webinars are which. But somebody dropped in, this was in predominantly Southern California. And somebody dropped in the chat, but if we don't test the mothers, how will we keep the children safe? Who would like that? And that is what we will hear. Who would like to respond to that one? Yes.
Listen, a lot of my mothers get tested. They don't mind being tested. The problem is that how they being tested. The levels are not being stated on the test. All they receiving is negative and positive. The percentages are not being documented on the tests. It just says opiates, benzos, and so forth. If they was to category what is being positive and the percentage, that is a different story.
Anybody else on the general question? If we don't test, how will we keep the kids safe?
Ariel, go ahead.
I would just answer that question with a question, which is, do you think that we are keeping children safe the way that we're doing things right now?
And I would just add, I'm really like thinking about it. I'm not a doctor. Let's pretend I'm a doctor in a hospital setting. And I have reason to believe that someone is currently under the influence or has recently been under the influence of a substance that I think might be harmful to a child, either in utero or after, during parenting. I have to have information to that end. I either my patient has told me about their substance use, or in which case, why do I then need a test? Because I have other information. Or there's a true medical emergency where someone's not able to communicate with me, or there are physical symptoms going on. But the reality is the test, like in New York City, I'll say, the test has a variety of things on the panel. For example, marijuana, where there is no medical intervention for a child or a birthing person. So why are we testing for it? That goes to, I think, Rachel and Ariel's point of, it then becomes just a piece of, as an attorney, it's a piece of evidence in court. And you're getting medical professionals to gather legal evidence for you at that point. And then to add to Ariel's question is, how is the test keeping the baby safe? If it's going to be used for something other than proof,
I think
to justify the separation.
The inference in the question was, well, if we find out that mom is, quote, using, unquote, the child must be unsafe. How would you respond to that person in the chat?
It's just not true. I mean, the other reality of all this is, and I don't, then we're going to go into universal screening, but the reality is we don't test everybody, right? So if we really believed that the test is going to keep children safe, then we don't test wealthy people on private insurance. We largely don't test white mothers or wealthy birthing people and their children. So it's kind of hard to believe, let's say, that we really truly believe that the test is going to keep someone safe. We have assumptions, racist biases and classist biases about who can parent children well. And that's the reality of it, substance use or otherwise. So yeah, that's my 2 cents on that.
No, it's interesting you mentioned that. I resisted the temptation to respond in the chat. That was a Southern California webinar, and I resisted the temptation to post in the chat as an answer. How do they do it in Beverly Hills? Anybody? Yes, Ms. Narva.
I would just also add that it seems that the test is a protective measure for liability in a worst case scenario situation. So what we are doing functionally is testing every parent and treating every parent and family as though it is a worst case scenario situation. And that is not doing what it needs to be doing. It is not supporting families, and it is not keeping families or children safe. And in fact, it is inflicting multi-generations of trauma on family systems and on communities. So I think that creating a system for testing that is 100% a catch-all, like everyone is then caught in a one-way system that is set up only for the worst case scenario, is actually a little bit crazy if you think about it that way.
If you're watching the chat, you'll see the comment. It's like the child welfare version of stop and frisk, which I think is very apt. Nadeem, did you want to comment?
No, you
okay.
you read my comment
I
out
read your
loud.
comment.
And
Okay. Please go ahead.
To that end, I want to make sure I also emphasize that I imagine in Philadelphia as well, but as an advocate, parents of not newborn children are also being asked to take drug tests without court orders, without corresponding litigation, without understanding what the consequence of that would be. And again, unless there's this is especially true of a parent of a 10-year-old or a 5-year-old, unless you have evidence that something of an actual harm to a child, then I'll take that back. If there's evidence of harm to a child, you don't need the drug test because there's actual harm. So if you're asking for a drug test, you're just looking for evidence. And I think that's why I wanted to share this when we talk about stop and frisk, because it's not just birthing and pregnant people that are experiencing this. It's parents of children. And so we're talking about communities that are being harassed in this way throughout the course of their children's life.
And as I understand it, it doesn't even have to do with an allegation involving substance abuse. Whatever the allegation is, they show up at the door and you got to take a drug test.
And there's a call is made in, and there's a checklist of things I have to ask. It might include a strip search of a child, talking to a child without their parents' presence, getting those confidential HIPAA releases signed, and taking a drug test. And it'll be presented as kind of routine, and this is what we do. And I'm a social worker coming to your house to help you, which is just not the reality of the situation.
Which raises another issue we're probably going to need to get to in the course of our subcommittee's work. New York has legislation pending that would provide Miranda rights in this situation. And speaking of things where New York is a bit ahead of Pennsylvania, in New York, marijuana has been legalized. And as the story in which you were quoted talks about, it includes specific provisions saying you can't use marijuana use against a family. In Pennsylvania, of course, only medical marijuana is legal. And nevertheless, people have been brought up on child welfare charges for using medical marijuana. What should the approach be? Any of our panelists who want to answer, to dealing with cases where the quote issue unquote is marijuana?
See, the thing
Yes.
is that when the women are if they are being treated with marijuana for mental health, because a lot of them don't want to be on benzos. They don't want to be treated with that because they're down, they can't function. So if they want to go natural, more of course. And I apologize for the background sound.
That's okay. This is
Javier, can you lower that for me?
This is a family-friendly subcommittee. It's fine.
Thank you. Appreciate that. So they want to go towards a more natural route and taking pills. So when you apply for your medical marijuana treatment card, you are given a waiver that states that that if you are caught or anything, that they cannot be held responsible if your children are taken away from you, that you get waiver your rights and understanding that your children can't be taken away from you.
Okay. Anybody else have any? We're coming up toward the end of our time. I know there is one other person who'd like to get a comment in, but before that, do any of our guest speakers have anything they want to add? Or Nadim, do you have any other questions?
No, I'm chirping in the chat, so I'm
Yeah,
okay.
I do see that. Yes. Okay. Carolyn Hill, I am told from Pat Albright, wanted to get a comment in. Please go. So as long as we have some time, we're glad to open it up to other people who are with us.
Yes, I'm saying that there are testing mothers for marijuana. The workers are, but what about testing the workers that's partying and doing marijuana themselves? Because I have been to certain parties and I have seen workers, and I know they do, but they ain't being tested. And I can't mention no names of who they is or nothing, but I know they're doing the same thing we mothers are doing. And so they should play a part too. So when they come out and they, like they did with me, they took my two nieces for no reason at all. But the mom kept calling them and they know the situation of the mother, but they still was listening to the mom. And I found out later that that's what was going on, that the mother had been calling them and telling them lies about me instead of them asking me.
Yeah.
And they knew the mom had a health mental issue. That's why they took all her kids from her.
Well, in fact, you raise an excellent general point, which was also aptly summed up by another outstanding family defender in New York. I think it was Emma Ketteringham who wrote an op-ed for the New York Times that said, I've got two piles of folders. One of here is about clips of groups, middle-class families, moms who brag about their marijuana use and how it helps them be better parents. These are the case files of the kids who are under, my clients who are under investigation because of it. So I think it applies clearly even beyond the workers.
Mm-hmm.
I think that's absolutely right. And I think what Ms. Hill's pointing to is a double standard within the system and in our society generally. And something that we see in New York City a lot is, let's say a parent maybe did have a mental health crisis and they were separated from their children and they worked very hard to get the support they need and the resources they need in place. Months later, they share that they occasionally use marijuana, and then it suddenly becomes the reason to continue the family separation, to keep a kid in foster care. And even in that situation, we have to push ourselves to let go of whatever judgment we have, stigma we've placed on marijuana use, and particularly in communities of color, and acknowledge the agency that adults have when they use a substance and their ability to titrate, to think responsibility, to use when it's appropriate. We have a very abstinence only zero-sum game in the child welfare system and the family regulation system. It's like you have to do what we say, down to the exact wording of an order in order to get your kids back in your care. And we've lost sight about what we're supposed to be talking about, which is safety of children.
Before we go, I want to circle back to a comment that I believe Ms. Narva made at the very beginning in her remarks about how there are the policies in Philadelphia, and then there's what really happens. Can you give us an example of disconnect between policy and practice?
Am I the one who, I think there are other people on this panel who
Other people are, well, I mean, I don't mean to single you out. I thought it
No,
was
that's
really
okay.
anyone's
No,
welcome.
I mean, it's definitely true. I think, gosh, I don't even know where to begin, honestly. I think, every DHS is empowered to essentially do what they want. And I think that, it is probably not policy to ask for certain things, to, demand certain things. It's certainly not policy to use a parent's resistance or request for a warrant or just sort of statement of their own rights. It is probably not policy to use that against them in family court, but is most certainly practice to use that against parents in family court. It is probably not policy for DHS workers to inform pregnant people who are involved in the system with previous children that if they give birth to a baby, that baby will be taken from them, but that is most definitely practice. And we have had several abortions in our program. Parents who are pregnant when they're referred to us, who have their previous children involved in the system, they're pressured by DHS and they choose to terminate the pregnancy. So I don't think that's policy. Do you?
Just wait a minute. I really want to listen to that again. You are saying that DHS actually pressures pregnant mothers who have lost children to the system to
No, they
terminate?
don't.
Oh,
They
sorry.
don't pressure them to terminate, but they
Okay.
definitely intimidate them and let them know, if you have this baby, we
We're
will
good.
also take it.
And that in turn has prompted some mothers to terminate their pregnancies.
Yes.
Okay. Every time I think I can't be shocked by this system. Does anybody else have anything that they would like to add before we bring this meeting to a close?
The last thing I want to say is that putting everything we're talking about together, what Ariel just highlighted, this intense scrutiny and lack of support when
Mhm.
someone maybe is struggling with substance use, is
Mhm.
that the trauma of the investigation, of the separation and the ongoing surveillance is not helping anyone reach their goals around their substance use. It is an additional stressor.
Mhm.
I've worked with parents for years where ultimately their parental rights have been terminated. And the best I've seen them is after the system is out of their life. Coming to court, having an attorney,
Yeah.
having someone come to your home, having to only see your child at a foster care agency, it doesn't help anyone feel good about themselves, feel confident as a parent. Any of the things you need to have the wherewithal to overcome a real substance use problem.
And on that note, then, I'll draw this meeting to a close. Thank you all
Thank
very
you.
much for helping the subcommittee and providing extremely important context and testimony. We will be back next week, same time, different Zoom link, to discuss the central registry in Pennsylvania. Again, thank you very much, and the meeting is adjourned.
Thank you.
Thank you.